lighten your load with AI. Okay, now we're going to talk a little bit about the hype and reality of AI. So how many of you have heard about robots taking the jobs of your doctors and nurses? We're not going to need doctors and nurses anyway they're burnt out, anyway they're not coming to rural America. So let's invest in AI. How many of you think that that is a reality anytime soon? I think we all in the room understand that the fax machine is single-handedly being kept alive by the healthcare industry. So we got a lot of innovation, but we got a lot of realities, right? There's a lot of hype and there's a lot of reality when it comes to AI. The important thing to remember about AI is what we talked about in the beginning. When your doctors and nurses raise their hands, they are burnt out. Why? Because of paperwork and bad technology. So focus your AI investments on that. Focus your AI investments on documentation. Focus them on not replacing the doctor or nurse, but augmenting clinical decision support. Prior auth. Does anyone enjoy doing prior auth? Nobody enjoys doing prior auth. Stick AI on that, right? And as we think about drug discovery and the leaps and bounds we can make in drug discovery with AI, it's phenomenal, it's incredible. But this is the low-hanging fruit in AI. There is no consumer that knows, likes, or trusts an AI robot. So they are not going to come to your hospital system to see an AI-enabled robot. But if their doctor, the one they know, they like, and they trust, Dr. G, for example, has that robot in the back, and it's a tool that makes me better, faster, why not? Just like a CT scanner, just like an MRI, just like a Da Vinci robot. It becomes another tool that your doctors can use to be better at what they do best, which is seeing patients. We know that AI could lead to savings in the billions. Upwards of 360 billion is the current projections. Data. This is critical. When you look at solutions, so much of healthcare is about the data. And interoperability is one of the biggest mistakes that we have made in the industries. Listen, as a rheumatologist, I'll just give you a clinical example. As a rheumatologist, when patients are sent to me, I ask the natural question that any specialist would ask, just why are you here? Why did your primary care doctor refer you here? And they say, well, Dr. G, I think they saw something on my blood work. And I say, okay, what was it? And then I say, did you do an x-ray? Did they take a picture of your hands or your feet? And they say, well, you have a computer. Can't you look in your computer and see what my blood work and my x-ray was? And I, of course, smile because this is not the first time I've been asked this by a patient. And I say, no, that's a different hospital. We don't talk to each other. Of course I don't have your data. This is the first time I'm seeing you. So what do? I do the same thing that all your doctors do. I have to repeat that blood work. I have to repeat that x-ray. And what does that do? That delays the diagnosis. That delays the treatment. It's a bad experience for both me and the patient because that is an important slot that I just took away from someone else when I could have just gotten straight to, yeah, I think you have lupus, or I think you have rheumatoid arthritis. But I didn't have the data. This is an area to invest in that will lead to tremendous, tremendous savings. Creative co-opetition. So remember we talked about the big retailers and we talked about big tech. There's an opportunity here to partner. So while all of us in the room understand that going to a retailer is not the best care, it is not the best care for a patient with chronic disease, right? We know outcomes data tells us that the best health care is when we take care of a patient cradle to grave. And they actually know us as doctors and we actually know them as patients. But that's simply not the reality that we're living in. When you just heard from Dr. Conroy that it takes upwards of 6 months sometimes to get a primary care appointment, depending where you are in the country. So there is a role for retail health, and there is an opportunity to look at them. It's not just competition, but perhaps as a creative partnership for referrals, right? Because if some of your patients can get a simple blood pressure check, get their eyes checked, get their teeth checked, it's a pretty low acuity visit. Understanding that the hospital is where the higher acuity patients will be and the procedures will be.